And we're live. Sorry about that. We're seeming to have some connection problems today. So anyway, thank you so much for joining us. For those of you who are joining us for the first time, my name is Ayesha Sherzai.
And I'm Dean.
And we're both neurologists. I'm a vascular neurologist. Dean is specialized in dementia and behavior. And today we're going to talk about a very important topic, pharmaceuticals versus lifestyle medicine. It seems to be one of the hot topics, especially in the world of science and among physicians, because there are some physicians who believe that medicine is it. That is the way how to take care of health, how to treat patients, and that lifestyle has very little to offer. And we're going to talk about the nuances of why that is.
Yeah, I mean, Aisha will go over the details of the papers, research, everything that's been shown to demonstrate effectiveness of lifestyle. Yet there seems to be disconnect. Where is the disconnect coming from? We believe it's coming from our field in medicine. Medicine is not making the right efforts, not pushing the agenda of lifestyle, is not doing the necessary things to show that this is not a futile battle, that this is actually the only way that you can actually make long-term effect, have a long-term influence over health is through lifestyle.
And in fact, you know, when you look at it, medicine, the medical field has been set up in a way where the model is such that we essentially wait in the hospital for the patients to come in with a health issue, with a disease. And we're trained in a way where we only focus on the disease, and our main goal is to get rid of that disease. And the only tools that are given to us are medication and procedures. And then that's mostly where the interaction between the doctor and the person comes in. And after that, even though when they follow up, it's usually with a mindset that the disease needs to be allayed or taken away with medication.
There seems to be such an immense disconnect. This is where you actually learn the concept of personal bias, this blind spot. When most doctors, fairly smart, they don't see the blind spot. It bewilders you. How could the rest of the healthcare system make the changes, the necessary changes?
Absolutely.
We know that the healthcare system is not a healthcare system. You'll hear this from us over and over again. It's disease-based, disease care system. It's not sick care system. It's not healthcare. We learn about it, and the problem is because of our education, the path that we've taken. 4 years of medical school, college, very focused on biology, chemistry, and so on and so forth. Then 4 years of medical school, very focused on diseases. A cursory course here and there, not even course, a lecture here and there on prevention.
Which most of us skip.
Yes, most of it. Well,
I didn't skip.
Yeah,
I did not skip that
of course. But then the residency, it's completely hospital-based in some clinic. And then you go out after 12, 13 years, and you're supposed to talk about prevention, about primary prevention. Impossible. It doesn't exist. And we do although the billing says if you want to get paid more, you have to say that more than 40%, 50% of your time is spent on advice and counseling. And everybody writes that, but it really does not take place. That's the last 2 minutes at the door where they say, oh, by the way, eat healthy and do this. And it's all cursory. This battle is now being waged on the battleground when it comes to the dietary choices, lifestyle choices, on these pages, websites, TV shows. But that battle is not a real one. The data is clear. Lifestyle works. And a certain type of foods don't fall for these gimmicky paleo and this and that. These are all things that actually sell books. The data is clear. There is no question about it. For those who want to make the argument and don't want to make it confuse the issue, the data is completely clear, and we'll talk about that.
And speaking to that, there are a lot of research studies and a lot of data out there that clearly describe the importance and the advantage that we have with lifestyle intervention. And when you look at the guidelines that are put out by major health organizations, like, say, for example, the American Heart Association or the National Heart, Lung, and Blood Institute, the NHLBI, the National Cholesterol Education Program, and so on and so
By the way,
forth.
by that NHLBI, you missed the L. That was pretty
National
cool.
Heart, Lung, and Blood Institute.
Yeah, that was a difficult
They
one.
really have to work on their
Better acronym.
acronyms.
Yeah, exactly.
The worst one was the one for blood pressure. But in any case, all these large acronyms, and these are the governing bodies of health organizations that put out guidelines and information for the public to understand where we stand as a nation as far as health is concerned. And when you look at it, their front message has always been lifestyle. If you can treat or if you can manage a lifestyle risk factor with changes in your diet, exercise, with your stress level, that's the best way to go. Of course, it's important to have medication on board. Yeah. And then there are several other studies that have shown very clearly that lifestyle seems to make a major difference. Like, for example, the biggest one was the Leonhardt study, where lifestyle, a combination of nutrition, exercise, actually reduced 70% of the outcome, the cardiovascular disease outcome. And then there are other ones, DASH, or Dietary Approach to Stop Hypertension. Those studies actually have shown that a plant-based diet or a diet that is low in dairy products can lower blood pressure, and it can lower blood pressure effectively or even more than just medication. The diabetes prevention program showed that people who adhere to a lifestyle had a very, very good outcome. As a matter of fact, their diabetes actually was lowered more than taking metformin, which is one of the most powerful medication for diabetes. And there's so many other studies. The Portfolio Diet Study, which comes from the University of Toronto, and they found that the diets that people followed, which was essentially a plant-based diet with very low amount of saturated fat, significantly lowered LDL levels, the bad cholesterol levels. Yeah. So and I can go on and on and on about all these other studies.
We're not against medicine. In fact, we're very pro-medicine. Without medicine, we wouldn't be here as far as people average age of 78 to 80. But what we're saying is medicine has its place and lifestyle has its place.
Of course.
When it comes to majority of healthcare, it's lifestyle. Medicine is usually in acute situations where you need to treat the acute situation, and then lifestyle takes over time. Such as if somebody comes in with a hypertensive urgency or emergency at above 200, we're not going to institute lifestyle. Lifestyle takes, it's a long-term change. You have to control the blood pressure with medication to make sure that it doesn't turn to strokes or heart attacks. And then over time, you institute lifestyle, and over time, lifestyle takes over, so you don't need the medicine anymore.
I like the analogy that one of the physicians actually used once, and I read about it. It's, the example is given of a person close to fire. If a person is really close to fire, there is a big chance that the person might get burnt. So you think about wearing a suit, an asbestos suit at this point. But if you're running away from the fire, then that's the situation where you can think about lifestyle, and you can institute medication plus lifestyle, because you're further away from that danger zone.
Yeah, absolutely. The same thing is when it comes to all cholesterol-lowering medication and diabetes and blood pressure and all of these things. Reality, the other element that we have to, and sleep medicines as well, the other element we have to add is none of these medicines are without side effects. They all have some measure of side effects, some more than others. And we're beginning to learn that some of them might have significant side effects that pertains to my disease, cognition, long term. The brain and your cognitive function is the ultimate byproduct of everything you've done in life. The approach that others have taken, which is this one protein amyloid, we think it's wrong. Right. We know that's an important component, but it's the cumulative lifestyle risk that actually ends up leading you to where you will end up with the disease, at what age and what manifestation. So it's really important to also take into consideration that these medicines are not without side effects. Some of the medicines that recently came up with the PPIs, which are the proton pump inhibitors.
The Prilosec and omeprazole.
Correct.
And medication that we take for heartburn.
Yeah, and long-term, people who have taken these medications seem to have higher risk of dementia. And the same was true for many other diseases, medications as well. Yeah. So we really have to be careful as far as when we need to take medicine, how long we need to take medicine, and that gives you even more reason to start lifestyle early on.
Absolutely.
Now, lifestyle is not easy.
Yeah.
Nobody will say that it's easy.
Absolutely, and that's one of the reasons why there is so much pushback for lifestyle. It's because physicians as well as the general public think it's really, really hard. And absolutely, I mean, changing one's habit that has been set for a lifetime is very, very difficult. But why is it that we're having so much resistance, especially from the medical community? I can speak for myself.
Yeah.
Well, first of all, there's this myth of futility. You know, some studies have come out saying that lifestyle actually didn't work. For example, we can give examples of a study that came out a couple of years ago, the Look Ahead study, and it showed that lifestyle was actually useless for a group of people who had diabetes.
At least ostensibly, it looked like it.
Correct, but when you actually look at, you know, the smaller analyses or the type of patients that they had chosen and the outcome in those population, it was actually really good. They lost weight, their cholesterol went down, their sugar levels were normalized. We believe that it's either the selection of the participants that were not very well, or the data wasn't appropriately analyzed.
Or the intervention itself. One study that we were part of, we're not going to name it, the intervention as far as lifestyle or food was these bars that they were given.
Right.
First of all, the bar was actually not healthy completely. The second element is that's not lifestyle. That's an artificial introduction of a bar as a lifestyle item. People will fail that. They will actually cheat around it.
Yeah, we don't need bars.
There's data. We don't. For forever. So that's why the few studies that are used by those that want to use them for their purposes that shows failure. They're not failures. But more importantly, the bulk of studies repeatedly, consistently have shown when applied, lifestyle always works, 100%.
Yeah.
And even those studies that have shown positivity and they showed 60 or 70%,
yes,
the 30% that failed was because they didn't apply the lifestyle.
They sure didn't.
Yeah.
Yes. So, you know, I think it's important to mention here that from these studies we've understood that it's not about motivation only. It's not about desire. It's not that simple. It's about placing a system to make sure that there's success.
Yes.
And that failure is minimized. And that's what we're feeling as a scientific community, as doctors. It's very easy for a doctor to say, well, Mr. Smith, it was great seeing you. Oh, by the way, you need to eat healthy and you need to exercise.
And you have to be motivated about doing so.
You can do it.
Yeah.
That doesn't really work.
There is no such thing as motivation. I'm sorry, this is going to be controversial. It's a series of successes that make you feel good and keeps you moving forward. And in order to create a series of successes, you have to have a system in place that can make sure those successes take place. We had this talk with our daughter Sophie,
Absolutely.
And she was talking about motivation, and and that's the worst thing you can do with kids or anybody else.
Yes.
Is because when somebody does something, of course everybody has the New Year resolution motivation thing, but over time you lose that motivation and you start judging yourself. Why am I not motivated? What is it? What's going on? And there is no such thing. It's a pattern of creating little successes, and then those successes accumulate into a totality of outcome, and then the bigger motivation that comes about. So if I were, I mean, I don't know if you agree, but I would get rid of the word motivation and focus more on a system, an environment, a family structure that creates a culture of success, which becomes behaviors, behavior patterns, becomes habits, becomes a culture ultimately. That's my definition of culture, which is behaviors and thoughts that are ubiquitous in a population or a group or a family.
Absolutely.
Why is it ubiquitous? It's unspoken because it's been done over and over, and enough successes have been connected to it that it becomes a living structure, a culture.
Absolutely. And also I think it's about time that we think of it as a bigger project. It actually takes a village.
Yes.
We have to seek help from other healthcare providers, dietitians and nurses. I mean, of course, doctors have the most amount of interaction with patients, but it's important for us to actually think of outside this particular system.
Absolutely.
And not wait for the patients to come into the clinic, but for us to actually go out in the community and talk about this.
In our book, Alzheimer's Solution, we actually had a little pushback, not so much, talking about the community, the environment, the family. It's not the sexy thing. It's not the interesting thing, but it's the right thing. It's the real thing. The reason that we actually have come back and are working in the communities, everywhere we go, we work in communities. Those people who know us, they know that we've worked in every single community you can think of, from Hispanic, African American, Asian, immigrant, Caucasian, you name it, every community. As communities that they define themselves, we go and help out create structures and work around those structures. The faith-based communities that we went to, the same thing.
Absolutely.
And it takes that level of structure. Now, in your home, you might say, I have no control over my community. But guess what? Your family, primary family, and your secondary family is your community.
Yes.
And that's where we can start. That's where those who are motivated, there I go with the you, actually, those who have the tools, those who have seen the success, those who really see value in it, create a group and they move others towards it.
Absolutely. So we're going to move on to some of the questions that we have. Thank you for your questions. So our first question is, what do you suggest to use, more medication or herbal? Well, so the discussion was about lifestyle in general, and sometimes, you know, people want to hone in on a specific item, whether it's a food or a type of exercise or one type of meditation. And what our approach is, it's not one food, one item, one vitamin. It's actually a pattern of living.
Yes.
So you have to do all of them at the same time.
Not necessarily at the same amount.
Agreed. You know, depending on your risk factors, sometimes you have to focus more on food than, say, for example, stress reduction, or you have to focus more on moving than your food if you're doing a great job. So it's very personalized. And in our book, that's what we try to say over and over again, that, you know, it's not a cookie cutter healthcare system that, you know, one set of rules applies to everybody. Everybody's different, and they have to weigh in on what's good for them and what's not really beneficial for them and move forward with it. As far as herbal medication is concerned, you know, there's really no data about specific herbs. If you're referring to, say, the herbs that are found in
Ginkgo
natural stoves and ginkgo biloba and things of that nature, there's very little evidence that, you know, most of them actually work. And
this is controversial. And I know we're going to get some
pushback. Yes.
But we're data driven. I mean, we're not against herbs. All of medicine came from herbs.
Absolutely.
But we say they have to have been tested. They should have shown results. And it's only then that we can say it works. Otherwise, you have over nearly 50,000 herbs. So which one are you going to choose?
Yeah. I think the best herbs are the ones that you eat in your food, you know, the spices and the herbs, because they have a lot of anti-inflammatory and they're plants, and a plant-based diet is good for you. So including them in your food is a great way to go. So thank you so much for your question. The next question that we have is, let me just go ahead and open it right now, is from Martin. And he says, how is it possible to make lifestyle change when we are surrounded by foods that are not good for you? Martin, that's a fantastic question.
Yes.
And that is what I think all of us battle on a regular basis. You know, there's these fabulous restaurants, there are vending machines all around the place.
Everywhere.
We work so hard, we sleep so little, we have little time to cook and prepare food for ourselves. So it is a constant battle. But the way we approach it as a family and the way we work with our patients is preparation. Really, you know, setting everything ready so that you don't get to a point where you rely on the vending machine or on unhealthy restaurants. A little bit of preparation can actually make a big difference.
Preparation is everything. As far as behavior, that's my feel. Behaviorally, it's impossible to control yourself, no matter who you are, if you're not prepared. The limbic system, the emotional brain, is way more powerful than your frontal lobe, and it will always circumvent. It will always take control of it. The only way that you can actually control that interaction is if you prepare it ahead of time. If you know that if at your work, this vending machine has Cheetos. We're not going to say who likes Cheetos, but you know it's going to get you in trouble. So you try to avoid it during the times that you're hungry. You eat ahead of time. You get food prepared ahead of time. The same thing when you go on trips. We just came from a trip, Eclipse trip to Idaho. Every single stop, there are these amazing restaurants. Yeah. And so what we did was we prepared ahead of time. We ate before we went to the restaurant, ironically. So that we don't let hunger drive us.
Yes.
And second of all, we actually now we have these smartphones. We went into the menu and saw what was available and which ones within certain mileage had the kind of food that we thought were healthy, and then we chose accordingly. In fact, now with Yelp, with all these other tools, you can even pick which restaurants are healthy as according to X, Y, and Z.
Yeah.
So
Yeah.
not just for food, not just for lifestyle, for everything, preparation is the key. If you want to build positive habits, positive, repetitive successes, the only way that you can make sure that your emotions, your limbic system, your drives, the primal drives don't take over is preparation.
Absolutely.
Knowing what's good when it comes to exercise, nutrition, and preparing ahead of time, and knowing yourself. In fact, our lifestyle program that we've alluded to in the book, as well as the one that we're instituting in Loma Linda, works around each individual person's strengths and weaknesses. That's the center of actually what we do. What's their weakness and how you avoid it, and what's their strength and how we build around it.
Absolutely.
That's critical. We have the family meetings that we do work around this.
Yes, I mean, we get really nerdy about this. We have a list
Some of us.
we have we sit down and we plan it out. It's really not going to happen if we don't, especially when there's so much resistance in our lives. Anyway, thank you for that question. So the next question is from Sophie. Sophie says, is it okay to stop the use of insulin when committing to diet and exercise to reverse diabetes? Sophie, that's a difficult question. I would say no, because it depends on
the type of diabetes.
Exactly, and it depends on the extent of diabetes. I mean, if it's, a very mild diabetes that can actually be reversed with some diet and exercise in the shortest amount of time, maybe. But I think it's best to, especially if somebody's on insulin, it means that it is, to a greater extent, and it's a type of diabetes that hasn't really been managed with medication alone, so insulin has been necessary. So I would say no, but there's so much evidence that glucose can actually be normalized and diabetes can actually be reversed with diet and exercise if it is continued on a regular basis. And so this is one of the questions that needs to be discussed with a primary care physician who can measure glucose, who can measure hemoglobin A1C, which is a marker that shows how your sugars have been in the past 3 to 6 months.
So absolutely, but it's important that if you go to your diabetes doctor, endocrinologist, let's say, and you see that there's a resistance when it comes to lifestyle, or they don't have enough information, which is very common, this doctor can take care of the diabetes, but for lifestyle, you can go to somebody else to help you out. That's critical. We did a study right now, which will be published soon, that the relationship between diabetes and dementia, significant, even among those who are treated. Mm-hmm. Yeah, if it's treated well with metformin and all the lives, they do better. But diabetes, even hyperglycemia, but without diabetes, short of diabetes, has been strongly associated with dementia and cognitive decline.
Definitely.
Forget about dementia, even cognitive decline as
a
we get
matter of
older.
fact, Alzheimer's is actually called type 3 diabetes.
By some, by some, exactly. So your question actually is perfect. We cannot stop certain medications. If you have high blood pressure, history of high blood pressure, you can't just stop medication. You must take the medication, but there should be a program placed where you can reverse the high blood pressure through lifestyle, exercise, diet, and everything else, and slowly, with the help of your doctor, taper the medication.
Right.
It's in that context that it will work.
And in the same line, somebody asked, is it okay if we live a very healthy lifestyle, do the right diet and exercise and take herbal medication? I would say no. I mean, if somebody suffers from, a real risk factor like high blood pressure and diabetes, I think it's important for the first few months when all of your markers are not normal to control them with medication and lifestyle, and not really, stop it and rely on lifestyle alone. Yeah. Those are great questions.
One thing I wanted to allude to, somebody is showing us the video, What the Health? It's become a big controversy. Yeah. I want you to ask yourself, there are many documentaries out there, many. Why is it that all of a sudden this one has become controversial? Let's say that the methodology used was poor. Let's say that the language they used was poor. Question yourself as far as why such an immense pushback about the core concept that lifestyle and plant-based lifestyle is effective. Why such a pushback? I think you'll have the answer. We won't get to allude into that too much more. Yeah.
That's for another day.
That's for another day.
Okay. All right. Let's move on to the next question. This question is from Karen, who is an LVN, a nurse. She's a single mom, and she asked us about the fact that she has 3 young kids, and their biggest problem is when they go out to have fun. She doesn't want to make her kids feel deprived. She feels guilty to push healthy foods. And so she was asking how she can deal with healthy eating.
Yeah, we've never experienced that,
Not
at
at
all,
all.
or from our patients. Yeah, you are the boss of the family, so tell us.
Oh, I don't think I'm the boss of the family, but I'm a good participant in the conversation. I think what we have done with our children is conversation. Why is it that we stick to a particular lifestyle? Why is it important that mom and dad have to eat healthy? Or why is it important for all of us to eat healthy so that grandma can eat healthy who has high blood pressure and some other risk factors? I think, sometimes we underestimate kids and we think they don't understand, but boy, do they understand. They are very, very smart. And, outside of just health, if you show the implications of how their brain will be healthier when they grow up, or how their attention will get better, and how their sleep will get better, I think it's easy to understand. As far as implementing it and going out, again, we just have to make lists of places that are amenable to changes, that restaurants that actually have healthy choices. And that's what we do. We don't even go to the ones that are unhealthy.
Yeah, and it is important that it has to be fun.
Yeah,
these
absolutely.
are kids, so it takes more work in a world where unhealthy food is the driving force, a major driving force of economy. That's a controversial statement, but absolutely true. Then it's going to be very difficult to find resources to make food healthy and fun. It takes work. It takes education. One of the concepts that we talk about, ADHD, especially for boys. I'm sorry, we were hunter-gatherers. All boys are ADHD to some extent. And then in the morning, you give them sugary cereals and you expect them to sit down in a room of 30 kids and concentrate. And if they can't, then you give them some pills to slow them down, and then you give other pills to reverse that. That's
terrible.
Insane.
It's terrible.
We all know this as physicians, yet we do this cycle.
Yes.
Food is critical. Food and activity and physical, of course, with less physical activity, this ADHD or hyperactivity grows further and further. So planning is critical. Making it fun as part of planning is critical. Creating communities, and there are communities out there that recognize what good, healthy food is and how to create communities around that. And distilling the junk out there that's trying to make a buck with the latest kind of diet that they know that you're close to that, you want to hear that. Oh, if I eat meat all the time, I'm gonna be fine. Or if I eat fat is good. By what data? You have to have done significant contorting, the kind that we've never seen on any show, that to create that kind of data. Or sugar is good for you. No, these facts are facts. But communities that can come together and help each other, and preparation is everything. And then what you said, the most critical thing, Ayesha, conversation. They've shown as behaviorists that you can make people do things by repetition. Mm-hmm. Then it becomes or by fear. Or by other means that are blunt mechanisms, I call them. But the way behavior sticks most, and behavior actually spreads from that core to others, is when the child understands the mechanism, what it does to their brain. We give talks to high school kids and to middle school kids. The amount of enthusiasm is bewildering.
It's amazing.
To talk about food to high school kids and they
I
get
think
excited.
they're my favorite population because I know that, they just absorb everything.
Because we show them what it does to their brain.
Exactly.
Yes.
So
Conversations as far as what it does to them, what it does to the environment, what it does to your family members, and how this will actually change. We've done it with my mother. How it will reduce her risk because she sees that we eat X, Y. So
Absolutely.
That's why it's important to have those conversations.
Contagious.
It is contagious. It is contagious.
Yeah. We'll talk about fun, healthy foods next time. So, healthy foods does not mean deprivation.
Not at all.
We do not believe that at all. And
I am not deprived.
Me neither. Me neither.
I'm not overweight. The camera puts some weight on me, I'm telling you.
It's the camera's fault.
Yeah,
me too.
But we're not deprived. We're very healthy, and we are doing, when it comes to sugar, when it comes to fat, we're doing very well, but it's all planning.
It is all planning.
And we will help.
Absolutely. We're here for you. We'll talk about that more. Anyway, another question, fabulous questions, guys, is does this risk of dementia also apply if you've had gestational diabetes? Hannah asked that. That's a little controversial. So,
There isn't much data to that effect. Some small papers that show some relationship. Myself, I think that the brain is so resilient that if you change direction, I mean, gestation, we're talking about 30s, 40s, 20s, 30s, 40s, now some 50s, but we're talking about making a change at any point in life, and the brain will do the rest for you. We've said this over and over again. It's the most forgiving, resilient organ in the body. When people talk about growing the brain, it's like, and they use the analogy of muscle, they can't be further from the truth. What's the biggest bodybuilder you know? He's increased his muscle mass by 4 times, maybe 5 times. I'm probably exaggerating. The brain can grow connections to the extent of 30,000 times.
Exponentially, absolutely.
20 to 30,000 times. 80 billion neurons making 30,000 connections. At any point, you can reverse, you can heal, you can grow the brain. That's why we're talking.
Isn't it amazing? So, we could lose the number of cells. As we age, the brain gets, it gets pruned, it gets smaller, it shrinks. But it's the connection between the cells that we have control over. You can have as little as, I'm just giving an example, as little as 2 connections between brain cells, or as many as 20,000 connections. And guess what? All the lifestyle changes that we're talking about actually builds those connections. So to me, I think that's a great news, and that's an empowering moment.
And we don't know of any drug that does that,
oh, no.
including the fancy ones with the jellyfish and the unusual fruit off an island in France, which are all gimmicks. None of them grow a single neuron.
Absolutely.
What does grow? Neurons, connections, brain, and the rest of the body, heals the rest, is lifestyle.
Yeah. Okay, let's move on to another question. Miriam, our friend, she is a mother of 2, but with an extended family that goes into dozens of uncles, aunts, cousins. You see the problem there. So that did not come to us, but we are asked often, what is the type of food that they should eat as a family? Especially when you're living with so many family members, and food is central for bringing everybody together. It's a social connector.
Yeah.
What do you do in those situations?
We've faced this. We have had gatherings in our home, about 60, 70 people.
Yeah. And
we gave them a plant-based, whole food, tasty food, and my mother almost had a heart attack. There's a pushback, there's resistance, but culture is built over time, over conversations, over realizing that many of those strokes that we've seen in our family could have been avoided. Many of the dementias that we've seen in our families could have been avoided. And people start taking the courageous step and saying, okay, you know what? Instead of this kind of food, today I'm going to just add this one heart-healthy, brain-healthy food. And speak about it and be the first to do so. And the more of us do this, the more we'll catch. Mm-hmm. And most importantly, for those who have kids, the most important gift we can give them is how they can heal themselves, they can keep themselves healthy.
Healthy habits.
And that starts at home. So if we're going to speak out for anybody, we'll speak out for our kids.
Absolutely.
And I think people will join. And I think in our circles, that has happened. We've seen more and more people joining in as far as healthy lifestyles, as far as meditation and relaxation and mindfulness and different techniques that help heal the mind and the body.
Absolutely. Okay, let's move on to the final question, actually. The question that comes to us from an aunt of ours is, which medicine should I be most wary about?
Yeah.
That's a tough one.
I have one.
You do?
I have sleep medicines.
Oh.
Because majority of sleep can be helped without medicine. First of all, a lot of people who have sleep disorders have medical problems that are causing the sleep disorder. Mm-hmm. So that has to be addressed, and that will help out quite a bit. The second group is a group that has built a bad pattern of sleep disorder, and that can be affected with sleep hygiene, which we'll talk about, and we'll even show what a sleep healthy room looks like.
Yep.
And then the third thing is, just because you're knocked out with sleep medicine, it doesn't mean your brain is healthy. In fact, or healing. In fact, sleep is the only detox that exists. It is an incredible detox. It's during those times where you go through the phases as well as our REM sleep that the brain gets rid of the oxidants, the inflammatory products, as well as amyloid and all these other things. And when you don't get good sleep, it damages the brain. It's an incredible state of healing. They've shown that many of the drugs, when you take the medication, you're out, but you're not going through the cycles. And therefore, the healing is not taking place, and you're still tired during the day. Mm-hmm. So for those who have sleep disorders and are taking sleep medicine, I beg you, get evaluated for the sleep problem. Find somebody that knows how to deal with. We do this all the time, deal with sleep problems, and then institute a more long-term plan to better the sleep, because that 8 hours is not just 8 hours of being knocked out. It's the most healing 8 hours of your life. All the meditation in the planet will not take care of 8 hours of what we call restorative sleep.
Yes, absolutely.
So today I think we've run over our time.
Yes, we are 9 minutes over, but we really appreciate the questions. Thank you so much. I think in conclusion, it's important for us to understand that lifestyle change may be considered difficult, but I think it's very, very important for prevention.
Yes.
And for living a healthy life. And that healthcare doesn't really start in the clinic when you visit your doctor, when they prescribe medication for you. It actually starts at home when you make the decision of how to eat, how to sleep, when to exercise, so on and so forth. And it's all about creation of habit, and it doesn't really take long. It just needs a lot of preparation.
Yes.
And a system placed in. And with that,
yeah, that's basically it.
Please go to our website. All this good talk has been described really well in our book, The Alzheimer's Solution, and especially the section. Sorry,
No. You're absolutely right.
Especially the section on the personalized plan.
Yes. So that section, which is how to institute it according to your strengths, your resources, is critical. And the book, although it's titled Alzheimer's Solution, it's about brain health in general. Avoiding cognitive decline as we get older. Past age 20, we start losing cells. So how to avoid that and how to maintain a vibrant, brilliant mind.
Absolutely. And with that, thank you so much for joining us, and we will see you next week with a different topic. For those of you who asked us questions and we didn't get to it, I'm really sorry, but we will answer you on Facebook by replying to your message.
And Hannah, it is called neuroplasticity. And please, if you want us to talk about a subject, send us a text, and we'll consider it as one of the topics coming up.
Have a wonderful week, and we'll see you soon.
Thank you.